Are you in need of someone to talk to today? You might consider a therapist. In this video, know more about the top 9 reasons to go to a therapist. Welcome back to Health Topic, where we bring you the latest trending and interesting topics on health, wellness, and prosperity. Consider subscribing and giving this video a thumbs up. Let's get started. First of all, what does a therapist do exactly? A therapist is a medical professional that evaluates, diagnoses, and treats anyone from emotional, physical, or mental ailments. Therapists analyze and recognize their patients' problems and coordinate through proper counseling. Counseling may be short or long-term, depending on the process of the patient. Being a therapist requires both inductive and deductive reasoning to convince their patients on how to resolve these problems sensitively. The Kelty Mental Health Resource Center distinguished several different types of therapy as follows. Cognitive behavioral therapy is an evidence-based therapy for several disorders. Dialectical behavior therapy is a cognitive behavioral treatment which involves an individual or a skills group session. Emotion-focused therapy, which focuses on how to deal with emotions. Family therapy, where a therapist works with the family to address the problem. Group therapy is a small group of patients or families where they meet regularly with the therapist. Interpersonal therapy is short-term treatment for youth with depression or any personal problems. Mindfulness-based therapy focuses on the purpose and present moment. Play therapy. This therapy is for children or youth where they may be able to express their feelings through play. Psychodynamic therapy focuses on how important one's early childhood and relationships can affect their development. Psychotherapy for parents and young children. This therapy aims to strengthen the bond between parents and children. There are several types of therapy that one must consider, and we enlist the top 9 reasons why people go to a therapist. The first reason: addiction. The habit or continued use of something such as drugs or alcohol is considered an addiction. Even if your body has been detoxed from these harmful substances, there are still chances that relapse may happen. This relapse may lead to stress. By seeking a therapist to treat addiction, they will help you manage life without using these substances. Counseling from a therapist enables people to cope with addiction through the use of cognitive behavioral therapy, teaching one to recognize moods, thoughts, and situations that may cause one's craving to use substances. Most of the time, it is better to treat addiction in a group. That way, a person with an addiction can feel the support from peers and not make them feel alone throughout their journey during the entire rehabilitation. Do you know someone suffering from addiction? Don't miss out on the other 8 reasons to go to a therapist. You might just be able to help someone else. The second reason: depression. Depression in the field of mental health has many symptoms everyone must be mindful of. These symptoms can be sadness, irritability, lack of sleep, or fatigue. In this aspect, a therapist applies psychotherapy in combination with an antidepressant that is said to be the best approach for treatment. Psychotherapy can be delivered in different ways, such as the form of individual therapy, family therapy, group therapy, or couples therapy. Individual therapy involves one-on-one between the patient and the therapist for full attention and allows the therapist to observe the patient properly. Family therapy is only necessary when there's a need to work with other members of the family, like for children or teens. On the other hand, group therapy involves a great number of people, from 3 to 15, where everyone is joined together to gain support and share issues with each other. Lastly, couples therapy is aimed for married couples that want to improve each other's relationship. Third reason: post-traumatic stress disorder. Post-traumatic stress disorder is reflected as a mental health state. PTSD for short, starts from triggering factors that are terrifying, causing nightmares, severe anxiety, and stress. PTSD can come on months after a traumatic event and disrupt social relationships. If you've been diagnosed with PTSD, then you will probably be advised to seek help from a therapist. The primary treatment is psychotherapy. Through this therapy, PTSD patients can regain their sense of control in life. Combining psychotherapy along with medications is still the best option for PTSD. Therapists may look after PTSD patients by teaching them how to recognize the symptoms, how to think better, how to cope once the symptoms arrive, and treating the problem. Also, the therapist can help in developing stress management skills to overcome the situation. Specifically, the psychotherapy methods that can be applied for treating PTSD include cognitive therapy, which help patients recognize the ways of thinking, and exposure therapy, that focuses on helping patients face the stressful events or memories brought by flashbacks or nightmares while learning to cope with them. Last is through eye movement desensitization and reprocessing, or EMDR, that is combined with exposure therapy, exposing clients to a series of eye movements that help patients process traumatic memories and change the way they react to them. Fourth, infertility issues. Infertility has been seen to distract a lot of marriages around the world. Since this is a sensitive issue for both members of the married couple, this may result in grief. Difficulties in having children are said to occur because of the issues in ovulation, fallopian tubes, an unhealthy egg or sperm, hormonal factors, and others. Doctors can attempt to treat fertility issues through medication, dietary, or lifestyle recommendations. There are several factors needed to be considered about infertility problems between a couple. Couples therapy can be used to treat the stress, anxiety, and depression brought about by the situation. Through couples therapy, communication between the couple is expected to improve and be easier in terms of making decisions that would work best for both. A therapist may also be able to discuss how infertility treatments should be pursued to decide what's best for the couple. In cases where other members of the family are affected due to infertility problems, group or family therapy may be more appropriate. Fifth, suicidal thoughts. If one is having thoughts of harming themselves, then a therapist's help is much needed. One of the best methods in treating suicidal patients, according to Lisa Firestone of Psychology Today, is through dialectical behavioral therapy, DBT. A person with suicidal thoughts generally has troubles in identifying and controlling their emotions. The therapist helps patients develop the skill of thinking and the need to be alive. Once the therapist improves the patient's thinking and staying alive, other psychological or underlying factors can then be addressed in order. Sixth, sleeping problems. Cognitive behavioral therapy is needed when a person is having problems with sleeping and considered to be the first line of treatment. This structured program aims first to identify the problem, then replace the thoughts or behaviors that worsen the sleeping problems. Also, this therapy can help a patient control and eliminate any negative thoughts that worry and keep the person awake. Some useful techniques for this problem that may be recommended are stimulus control therapy, sleep restriction, sleep hygiene, sleep environment improvement, relaxation training, remaining passively awake, and biofeedback. Ask your therapist first to know more about these options. Seventh, eating disorder. Eating disorders are characterized by irregular eating habits and severe consequences about body weight and shape. An eating disorder can come about because there is inadequate or excessive food intake. Both of these can cause a bad impact on one's health and well-being. A few forms of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating. A referral pool of health professionals is advisable to treat this type of disorder. These include mental health professionals, nutritionists or dietitians, and medical or dental specialists. For the psychological treatment in this situation, the therapy may last from a few months to years. During the treatment of an eating disorder, many therapists will require the patient to keep a food journal with them. This will help with tracking or reviewing the therapy sessions, while also identifying specific causes why a person is binging, purging, or doing any other unhealthy eating behaviors. Eighth, loneliness. Because there are many factors why a person feels lonely, there are also many treatments. Loneliness has been linked with depression, anxiety, or low self-esteem. As a result, sleeping and eating patterns are affected. Several studies show that lonely adolescents have a higher chance of drug usage and alcohol. Some issues to discuss when considering therapy and treating loneliness is addressing the causes that worsen the problem. Therapy can be done either with a group or individually. However, groups provide a sense of support and welcoming to all causes of loneliness. Lastly, reason 9, agoraphobia. Agoraphobia is an anxiety disorder with symptoms occurring or showing when a person feels not safe. Examples of places that might trigger this disorder are open spaces, public transport, malls, or outside of the home. This phobia is treated to escape the anxiety or stress it brings to a person. Psychology, together with medication, can help make the situation better. Through psychotherapy, a therapist sets goals to reduce or remove the anxiety symptoms. Additionally, cognitive behavioral therapy is one of the most effective methods for this problem. Throughout this, patients can gradually return to their usual activities and recover from their panic attacks. In most cases, therapists who are handling these types of issues can offer their help by sessions over the phone, email, or social media platforms to communicate with their patient, since people with agoraphobia are most likely afraid to leave their comfort zones. We've asked you earlier about your need for someone to talk with. If your answer to this is yes, please consider going to see a therapist. A friendly reminder that we here at Health Topic want your well-being to be as healthy as possible at all times. As Abraham Maslow said, we may define therapy as a search for value. Before we go to the end of the video, share with us what intrigued you the most about the top 9 reasons to go see a therapist. Subscribe and turn notifications on for more upcoming videos. Please remember to seek help if needed, stay healthy, and stay safe. See you soon.